Understand this cascade of biological tooth movement. So first of all, what we have is biophysical reaction. Now to remember all this, you have to remember CBT. So compression of the PDL. B, say you have bone deformation. T, tissue injury. Then it leads to the production of the first messengers, hormones, prostaglandins, and neurotransmitters like substance P, VIP, vasoactive intestinal peptide. Then it leads to the production of the secondary messengers, CAMP, CGMP, calcium, ions. Now very important, you must remember, if it is positive, it is going to lead to resorption. Okay, this is important. Negative, deposition will increase. So it will obviously, it will lead to cycles of resorption and deposition will lead to bone remodeling. Then it will lead to orthodontic movement. Now things you must remember, after first messenger are released, and then they lead to intracellular signaling, which leads to the formation of the secondary messengers, release of secondary messengers. This is basically an inflammation which leads to the activation of the collagenase. This is basically a piezoelectric response. Okay. One more thing. This process is transduction process. Now, what do I mean by it is, basically we had some mechanical injury over here. All right, tissue injury, compression of PDL, and bone deformation. So it was basically due to orthodontic force. Okay. Then it converted into a cellular response. So it is basically a biological transduction process. So this is the flowchart which describes the biology of the movement. So I hope I made it easier for you to understand. Do subscribe to my channel if you like the video. Thanks for watching. As I told you before in the video, that there is transduction process that is going on. Now the secondary messengers like CAMP production, now what happens is they'll alter the cell activity. Now there are two types of receptors, one is RI and one is RS. RS is the stimulatory, RI is the inhibitory. Now they have GS and GI proteins which inhibit or stimulate the adenylate cyclase enzyme, which leads to the conversion of ATP to CAMP, which activate the protein kinase A, which lead to the protein phosphorylation, which lead to the cellular response. Now this is a diagram in which it is osteoclast. Now over here, in main factor osteoclast is lysosome, which has cathepsin B, which is lysosomal acid protease. Okay. Now we all know that it is a multinucleated giant cell, osteoclast. All right. So it has a ruffled membrane at the site of the resorption. Now this ruffled membrane, it releases organic acids. Like citric acid, lactic acid, and hydrogen ions, which increase the solubility of the hydroxyapatite crystals, leading them to decalcification. Now, since CAMP is involved, this is a secondary messenger. Then there is an arachidonic acid pathway as well. Now, as we all studied in biochemistry, the phospholipids of the cell membrane, by the action of phospholipase, yes, they convert into arachidonic acid, which is a 20 carbon compound. Then there are two pathways, lipoxygenase pathway and cyclooxygenase pathway. Cyclooxygenase pathway, prostaglandin is released by COX. We have leukotrienes and hydroxyicosa tetranic acid. Yeah. So it leads to the increase in the osteoclastic activity. It is an important mediator for the mechanical stress and inflammation. Now at the end of the chapter, there are certain methods by which we can accelerate the tooth movement. First is the biological method, basically through drugs. So prostaglandin, cytokine, lymphocyte and monocyte derived factors, then rankle, then we have macrophage, then vitamin D, PTH. Okay, then physical methods. In physical methods, we have three methods. One is the low level laser therapy. The second is the ultrasound. Third is the resonance vibration. Now, low laser therapy, it is also called as cold laser. It does not increase the tissue temperature more than 1 degree Celsius. Also, in this, what happens is it increases the cellular metabolic activity, that is the osteoclast and osteoblastic activity. Then ortho treatment, it is seen that the duration for the ortho treatment, it is decreased by 30% through this technique. Then resonance vibration. In this, what we do is, basically we have an activator and we have a mouthpiece. The activator is the one which releases the signals and mouthpiece is the one which receives the vibrations. So mouthpiece is placed into the oral cavity. So 8 minutes, 3 weeks, it is seen that the tooth movement is increased by 15%. Ultrasound, keyword to remember here is LIPUS, low intensity pulse ultrasound. Okay. It basically leads to alveolar bone remodeling. Then surgical also, basically interseptal alveolar surgery, then corticotomy, osteotomy and piezoelectric technique. So this completes the biology of tooth movement.